Hello everyone, good evening everybody. I am Sania from Beautiful Spotless Skin. I am sure all of you must be keeping good health. You must have come across people, especially women, with brown colored patches on their face. They seem like freckle like spots forming large flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India, and according to a study conducted across 4 Indian cities, revealed that more than 80% of the population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more susceptible to pigmentary disorders. It occurs mainly in women, 90%, and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65 years old women present a facial melasma. Melasma and hyperpigmentation are generally ignored as a sign of aging and often misunderstood, sometimes related to hyperpigmentation issue. This can lead to frustrating setback in treatment, and to avoid all these hazards and to keep you informed, today we are here to know more about management of melasma from expert. So let's connect today with our skin expert, Dr. Meghna Gupta. She's a consultant dermatologist and cosmetologist based at Ghaziabad. Dr. Meghna has done MBBS followed by MTDBL from Maulana Azad Medical College, Delhi, and followed by DNB in Dermatology MRCP SE from United Kingdom. She is one of the leading dermatologists whose first motto is patient satisfaction. You can get complete skin, hair, nail, laser, and various aesthetic treatment at her clinic, MG Skin Individual. Doctor, a very warm welcome on our live.
Thank you so much.
And as we are going to discuss about a very important topic, that is melasma, how we can manage it. Before starting, everybody wants to know that what is melasma. We are going to talk about melasma. So what is basically melasma? How we can define melasma?
So melasma is basically an acquired skin condition, a chronic skin condition characterized by hyperpigmented or dark colored brown to black colored patches on the face, predominantly forehead, bilateral cheeks, dorsum of nose, or chin area. Sometimes it can also involve eyebrow area or upper lip area. So this is melasma.
Okay, so that means patches, on different parts of your face is basically called melasma. Doctor, when we are talking about melasma, what are the main causes of melasma? Why, people melasma happen? Are there any specific reasons? What are the causes of melasma?
See, melasma is a multifactorial disease. There are many causes which are related to melasma. Most important is genetic cause. So genetics is an important part which is being played for melasma. Apart from that, sun exposure plays a very important role. All the type of radiations like UVA, UVB, visible light, along with that infrared lights basically lead to free radical formation and increase melanin synthesis in the skin and leading to melasma. Apart from that, hormonal changes in the body, maybe during the during the menstruation or during pregnancy or postpartum, has been found to cause melasma. There are many drugs which are associated with melasma, like oral contraceptive pills, hormonal preparations, anti-thyroid medicines. Apart from that, anti-convulsant medicines for seizures, anti-seizure medicines like phenytoin, valproic acid has been found to be associated with melasma. Apart from this thyroid disease, it has been found there is 4 times increased risk of melasma in thyroid patients. So these are the conditions which are found to be associated with melasma.
Okay, so these
for melasma.
Yes, so these are the different causes of melasma. Due to different reasons, melasma can happen. And as you told that it can be genetic also. Like, is it like that if someone in the family or is having melasma, it can pass it on? Is it like that? It is like a genetic disorder, or I can say genetic. It can pass it on from one person to another in the family.
Yeah, it has been seen commonly, like some females, their daughters, their granddaughters are also having melasma. So it has a penetrance in first degree and second degree relatives also. And in some studies, it has been found that there is a 50% family history of melasma if a patient is suffering from melasma.
Okay, so some family history might have been found earlier due to that melasma happen. Is it like that, doctor? There are types of melasma, or the stages of melasma, that if somebody is having some kind of symptom, they can identify that this is particularly melasma. This is the first stage of melasma, and they should, don't go to a doctor, see a doctor.
So there are many types of melasma. It can be epidermal melasma, dermal melasma, or it can be a mixed melasma. Okay, epidermal melasma is characterized by a very well-defined brown colored patches in the face. Okay, the deeper melasma, that is dermal melasma, basically it's more of ill-defined and it's more of a grayish to blackish color. So this way patient can identify. See, melasma is totally asymptomatic. It does not cause any itching or something until unless you have applied any other creams which can irritate your skin. So if there is sudden appearance of, or if there is appearance of brown to black color patches on your cheeks which are bilaterally symmetrical, involving dorsum of your nose, your eyebrow area, upper lip area, and it is more commonly seen post pregnancy or postpartum, then it is probably melasma. And if it's only seen, like most of the times it is seen on face only, but sometimes other parts of the body can also be involved, and in that case we can get a diagnostic dilemma, like what it can be.
Okay, so the brown or black, or as you told, the grayish colored patches, in the cheeks or upper lip or in the face, and where is called melasma. Doctor, melasma and hyperpigmentation are any difference? Are there any differences between melasma and hyperpigmentation, or is it like the same?
See, hyperpigmentation is a very broad term. Hyperpigmentation is basically pigmentation of the skin or darkening of skin. This darkening of skin can be localized, like uh, fixed spots at some places, like secondary to insect bite, you can get black spots on your legs or arms, or it can be secondary to some allergic contact dermatitis, you can get some pigmentation on the forehead, like due to bindi dermatitis. Okay, so hyperpigmentation can be localized to some body parts, or it can be diffuse all over your body. You are getting darkening of the body. You can have darkening on the nape of the neck, which is called pseudoacanthosis nigricans. So hyperpigmentation can have many causes. Melasma is one of the cause for hyperpigmentation. Okay, so both the things, like melasma is a cause for hyperpigmentation, but all the hyperpigmentations are not melasma. I hope
Okay.
it's clear.
Okay. Yeah, yeah. So hyperpigmentation, all the melasma not comes in the category of hyperpigmentation, but it is hyperpigmentation can the melasma definitely
Happen. Yeah.
comes. That is the point. Okay, doctor, when we are talking about melasma, you have already told us the difference between hyperpigmentation and melasma. If somebody want to diagnose that this particular thing is melasma, how can somebody diagnose that if this is happening to me, this is melasma?
Pardon? Can you repeat, please?
Yes, yes. So I was asking that how somebody can diagnose it, that this is what is happening on their face is actually melasma.
Okay. So, see, if a person is, if first of all, melasma is more commonly seen in females and in the patients who are more prone to sun exposure. In females, it is more common. 80% of the patients are females and 20% are males. So, if you are getting the asymptomatic, like there is no symptom, there is no pruritus, itching on the face, or any redness on the face, and slowly, chronically, you are getting, gradually, you are getting brown to black colored, well defined patches symmetrically on your cheeks or your jawline area or dorsum of the nose, which is uh, only confined to your face, not involving all of your body. Okay, so this can be melasma. Okay, this mostly points towards melasma, and these patches more often is found to increase during sun exposure. So most of the patients give history, like when I am in winters, these patches decrease in coloration, but in summers or whenever I go out, I do not apply sunscreen, these patches appear. Okay, and this is a condition which is recurrent and which is not not curable. Okay, it will come, definitely come again if you stop applying sunscreen. So this is the basic history which patients normally give.
Okay, so if somebody is not taking proper, care of their skin, melasma can, happen again. Melasma can happen again if somebody is not taking proper care of,
Yeah, melasma can recur back. Okay, melasma is a condition which is a chronic condition. Like anything, no doctor in the world can say like I'll cure melasma 100%. It will definitely come back if you are not applying your sunscreen, if you are not keeping sun protection, adequate sun protection, you are not using any cream for maintenance, the melasma will come back. In very rare cases, like 0.001% cases, melasma is definitely like it does not come back.
Okay, so if you have to treat it well. Talking about the treatment, we have discussed about the causes, what are the types, what is basically melasma, and now talking about the treatment, what are the different methods of treatments, or we can say the treatments of melasma are available, and how a person, sometimes people self medicate also. That is,
Yeah.
somebody is having melasma, they apply some home remedy. How effective is that, and what are the different treatment options which are available for treating melasma?
Okay. See, first of all, coming to counseling, basically management of melasma is categorized into three parts. First of all is the counseling part, then is the creams which are available, and then we'll come on the medicines which are available, and then the procedures which are available. Okay, so coming to counseling, first of all, sun protection is really necessary. You have to apply a broad spectrum physical plus chemical sunscreen, that is with a SPF factor of more than 30 plus. Okay, you have to use 2 finger length of sunscreen, apply on whole of the face, half teaspoon or 2 finger length sunscreen, and you have to reapply every 2 to 3 hours. Okay, sunscreen should be applied 15 minutes before going out in the sun, because the action of sunscreen take around 15 to 20 minutes to start before, and it should be repeated every 2 to 3 hours. Apart from sunscreen, it does not mean you are applying sunscreen and you are going out in the sun. Try to cover most of the part of your face. You can use a wide brim hat, okay, which has a brim of around 4 centimeters, which just the brim basically does not allow the sun rays to reach your face. Okay, so broad spectrum sunscreen, hats, okay, goggles, these are the important things. You can also tie dupattas. Many you can see in North India, like many girls basically tie dupatta around their face and then ride scooties. Okay, so these are the things you can do for adequate sun protection. If you are not satisfied with that, also you should start oral sunscreens. Oral sunscreens in the form of beta carotene. Okay, 30 mg you can start daily. Okay, so this is the sunscreen wala part and sun protection wala part. Apart from this, topical creams, there are many creams available. There are triple combinations, double combinations like hydroquinone and tretinoin based preparations which are available in the market. They should be used only after consultation with a doctor, because there are many side effects of these creams also. These itself can lead to pigmentation if not prescribed in a and used in a correct way. Okay, apart from this, there are many depigmenting creams based on arbutin, kojic acid, okay, licorice based creams, and glabridine based creams, pine bar extract creams, aloe vera based creams. There are multiple creams which are available, which are help to tranexamic acid based creams, which are available in the market, and these helps to lighten the pigmentation. After a certain time, when your melasma is controlled, your patches are totally gone, then you have to apply a cream for maintenance, so that you do not get back the pigmentation. So that is also important. Not only just controlling the disease is not important, you have to also maintain the disease so that it does not come back. Okay, apart from topicals, there are some oral medicines also, like tranexamic acid oral. It is a plasminogen activator inhibitor. It basically helps in decreasing the melasma. It should be taken only under the guidance of dermatologist, because it has many side effects also, and we have to get some profile also done for some patients before starting it. Okay, apart from this, there are many procedural based treatment. Chemical peels are available, glycolic acid based peels, lactic acid based peels, tretinoin yellow peels. So these are some, the peels are basically some chemicals which are applied on the face, and they basically lead to controlled exfoliation or of the skin. And apart from that, act on the melanin inside your skin and helps to lighten the pigmentation. And there are lasers like Quisit and Diag lasers are available, which are helpful to lighten the pigmentation. Okay.
Okay.
And
So that
nowadays
means,
there is
yes,
role of
that
PRP also.
yes, yes, please continue.
So nowadays there is a role of PRP also. Basically, platelet-rich plasma and microneedling has also been found to be effective in melasma. And there are intralesional injections of vitamin C and tranexamic acid, which can be basically you numb the skin. So do not worry that injections will cause you pain. You have to numb the skin, and then we can insert intralesional injections of vitamin C and tranexamic acid. It works wonderfully in melasma. This is a new thing which has come into the market, and many people doesn't know about this. So that this is the thing. These are the many ways in which you can treat melasma. Okay.
Okay, that means melasma is treatable, and if somebody is having melasma, they should definitely go and refer to a dermatologist instead of self-medicating. Doctor, I am sure that in your clinic also many people might have come that they have applied some home remedy, and now the home remedy does not work, and the reverse effect of home remedy is on their face. Is it like that? That using home remedy is effective or not? And sometimes because it can cause reverse infection also.
I have seen blunders done by patients, like they are applying lemon on their face, they are applying anything, they are applying steroids on their face. Most importantly, these pharmacies, local pharmacies, they go to pharmacy and buy the cream, like any cream of 40 rupees, 50 rupees. Basically, in our country, like India, price is the most important thing when it comes to a patient mind. So अगर कोई फार्मासिस्ट बोलता है कि आपको 50 रुपए में आपका मिलाजमा ठीक हो जाएगा, तुम ये क्रीम लगा लो, बस ऐसे लगाते रहो. So most of the times patients are applying triple combinations. They're applying so potent matlab, steroids which are not safe for the skin, and they come with redness on the face, flushing on the face, hair on the face. They're looking like females are looking like bears. They have mustache. They have so many hairs on the face. These all are because of steroids. There is thinning of the skin on the face. There is more of acne. Okay, their melasma is worsened and their skin is also worsened. And these cases are very difficult to treat. These are called topical steroid damage phase. So this is the most of the, I have seen these sequelae in my practice.
राइट, तो अपने आप जाके सेल्फ मेडिकेट ना करें, कोई भी क्रीम ना अप्लाई करें, बिकॉज एज डॉक्टर सेड दैट it the melasma can be worsened, and she has already seen many cases in which hair has already come, and redness also have come. Doctor, when we are talking about the treatment, what are the worst, we can say worst case scenario if somebody is not treating the melasma? So what can happen if or somebody is treating the melasma, but they have not treated it fully. They have just left the medicines and the treatment in between. So what are the risk factors which are involved if somebody has not treated melasma?
See, there are no melasma is a cosmetic disease. Okay, I tell to my patient that melasma will come back. If you want to get rid of melasma, then treat it. Otherwise, if you cannot do anything, it will not cause you any cancer or something. Okay, it is a totally cosmetic disease. You leave it, the patches will increase in coloration or will remain stable. There will be darkening of the, there will be dark patches on the face. That's it. If you're comfortable with these kind of patches on your face, you can just leave it like that only, but do not destroy your face or damage your face by applying steroidal cream. Okay, so melasma does not have any sequelae. Okay, does not cause any cancer. Okay, this is a total myth. Okay, if you can just leave it if you don't want to get it treated. If you are watching your face in the mirror and it's not bothering you, then leave it. I will not say you get it cured.
Right, definitely. Doctor, as you said that, that melasma cannot be turned into cancer. As like that, there are so many myths and misinformation related to melasma. Would you please enlighten us some of the, misinformation which you have come across? People coming to you and saying, that melasma is like this or melasma is that. Misinformation, which you think that it need to be addressed in public, that this is a myth and this does not happen. As you said that melasma cannot cause cancer. Some misleading misinformation which you would like to share with us.
There are many myths related to melasma. First of all, melasma only occur in women. It's not true. It affects men also. Okay, many people think that melasma is only a hormonal condition. Okay, there is no role of sun exposure or sunscreen in it. Okay, so that point I wanted to emphasize that sunscreen application and sun protection is really necessary. Some people think that sunscreen is only required when they go out in the sun, and they do not know the role of visible light or infrared light. Okay, so they do not apply sunscreen in the indoors. Okay, so that a point I like to highlight, that infrared lights that emits from these tube lights, your cell phones, your laptops. Okay, so these are the things, your televisions. These are the things. This is a basically source of sun, basically damaging your face, leading to melasma. So you need to apply sunscreen in the indoors also. Okay, one more you mentioned that sun melasma basically leads to skin cancer. That is also not true. Melasma is a cosmetic disease. Okay, there is no systemic association of melasma. Like only thyroid is a systemic association with melasma. Like 4%, I told you 4 times increased risk of melasma in thyroid patients. Okay, so these are the myths which are associated with melasma.
Right, and you have told us already the myths, but in today's digital world, there are so many information which is already there, and people are applying something because somebody has in the social media has said how effective is that, and sometimes the people also do that. If some melasma is to one of her friend, and she said that I've applied this particular cream, you should also
Mm-hmm.
apply it, and they apply it, and then they are like कि okay melasma ठीक हो गया है, but at some point of time melasma occurs again. So what is your take on that?
I told you, like you should not rely upon the creams which are told by your neighbors, your friends, your. I'm not saying you do not basically rely on your friends, but listen to a doctor first. Okay, most of the patients know only steroidal creams for melasma. Okay, they just keep applying on it on the faces and leading to side effects. Okay, so and there are many myths like hydrofacial can also decrease the melasma. This is also not true. So there are lots of information about, there is lots of uh, um, myths about melasma and lots of wrong knowledge on Instagram and Facebook about melasma. So only listen that is true. Okay, decide your doctor. Consult a qualified dermatologist. There are so many beauty parlors where they are treating melasma. Like this is not the right thing to do. Okay, consult a qualified dermatologist.
Right. So if you have any kind of symptoms of melasma, do refer to a dermatologist. Doctor, sometimes we have seen that, going to a salon and they said, this particular type of facial can reduce the dark patches or reduce the melasma. And, at that point of time, people are happy because their skin is glowing. But what are the long term, if we talk about the long term effects of that particular facial, what are the long term, like, of that facial, and is it like that it is effective, that if somebody is going and taking those facials, over the counter products, or those facials, will it help?
See, facials, basically the main role of facials is uh, there is massage of the skin and there is increased lymphatic drainage of the skin. There is vasodilatation. Basically, the blood vessels dilate, and so there is glow on the skin. Okay, this is the only thing which basically is done in a facial. Okay, there is some sort of exfoliation also sometimes if they are applying any cream like that. But important is like they are not doing any test patch of the cream. Okay, you can get contact dermatitis or allergy on your face. Okay, sometimes this allergy can be so severe that it can lead to permanent pigmentation on the face. So you are going to the parlors to cure your melasma, and you are getting so much hyperpigmentation on your face. Okay, so this is totally reverse of what you are expecting and you are getting. Okay, this one thing, this extensive rubbing of the face can lead to clogging of the pores of your face and can lead to increased chances of acne on the face. So you can get more of acne. I have seen so many patients which are getting acne after facials, pimples after facials. So this is important. So if you want to get a facial done, consult a dermatologist. There are so many medifacials which are available in dermatology nowadays in the form of chemical peels. Okay, hydrofacial is a kind of facial, but this will not help to lighten melasma. This hydrofacial will not help you to lighten melasma. Peels will definitely work. So facials for melasma, I will not recommend it. Okay, this is only for glow. If you want to get a proper treatment, proper procedure for melasma, you can go for chemical peeling. You can go for lasers, but lasers will also be decided by a dermatologist, because first line treatment for melasma is only creams and oral tablets. Okay, if you're not getting relief with them, then you can switch to say, other modalities. Okay, so this there is some protocols of a disease how to be cured. Okay, you cannot decide whatever you want to take. Okay, so better to consult a dermatologist. That's the thing I'll advise.
Right. It is always better to consult a dermatologist, instead of self-medicating it, because melasma can get worse. Doctor, here comes one more question that, or if somebody, if lifestyle changes, somebody is not having a proper diet, does dietary precautions help in reducing melasma or increasing it as well? Somebody is having a good lifestyle. Is it like that the melasma will react differently? And if somebody is having, hassle lifestyle, not taking proper diet and not exercising, so is dietary or physical activities play a major role in melasma?
uh, See, in dermatology, many of the things are not like there is no much evidence about it. But yes, in reality, if we are talking to the patient, they are giving us much of a good feedback about their skin. They know, like stress is a very important cause which can lead to melasma. Okay, so if you're maintaining a proper hydration, if you are not living a stressful life, you're meditating, okay, you are taking a diet which is good, rich in antioxidants, like you're taking more of pomegranate, green tea, okay, oranges. So these are the diets which are green leafy vegetables. Antioxidant rich diet basically helps to lighten the melasma. So there, yes, there is a role of diet and stress-free life in melasma, but it's not 100%. Like, you do not apply any cream, you are not doing any sun protection, and your melasma will be cured by only having a stressless life and a good diet. That is not the thing. These are the agents which act synergistically to help you to lighten your melasma. They are not the actual treatment for the same. Okay, there are many channels on Instagram which are promoting only diet to be helping in all the diseases. This is not the thing. अगर डाइट से ही होता तो सबका बीपी हाइपरटेंशन केवल डाइट डाइट करने से ठीक हो जाता. So this is not the thing. Sometimes you need medicine, and you should always basically add these things to your medication, but not isolatedly believe or depend upon these lifestyle changes.
Right, very very well answered. That, there, if you need that, something for yourself, you need to work on it. That is more important. Doctor, we have some live viewers questions here. So there's a question coming from Suhana, that will melasma go away on its own, or it's a chronic condition that requires ongoing management?
Yeah, melasma will not go on its own. uh, you have to take a treatment for the same, as I told you. Like, there first of all, if you want to do anything for melasma, start sun protection. Sunscreen itself will help to lighten the pigmentation, will help to get, you will not get new patches at least. Okay, and if you want to consult, and if you want to take a proper treatment, then consult a dermatologist. uh, OTC products, like many kojic acid based preparations are available. You can try some kojic acid based preparations. Okay, I'll not reveal brands on this platform. Okay, but you can try some kojic acid based preparation. That I'll tell her. Okay.
Okay, okay. So there's another question from a viewer asking, can you recommend any sunscreen or skincare products that can help protect my skin and prevent melasma from worsening?
You can there are many sunscreen which are available. Okay, so you have to look for a broad spectrum of a mix of both physical and a chemical sunscreen with a PA factor of 3 plus and SPF 30 plus. That is the thing you need to look for. There are many sunscreens which are available in the market. Okay, that he can choose according to his skin type. If he or she has an oily skin, then use a gel based sunscreen, and if you have a dry skin, use a cream based sunscreen.
Okay. Applying sunscreen is a very important thing. So please do apply sunscreen whenever you go out or you are indoors as well. Doctor, there's another question from a viewer asking, how is melasma diagnosed and are there any specific tests or examination that need to be done to confirm the condition?
Melasma is a clinical, melasma can be diagnosed clinically. Most of the time, there is no need to get any test done. It is a disease in no blood test basically will reveal that you are getting melasma. Okay, there are no blood tests available. But yes, dermoscopy basically helps in a magnified view of your skin. Okay, there is a scope which helps to magnify the skin, and we see the changes. What is the pattern of pigmentation, and we diagnose that this is melasma. But this is dermoscopy can help you to diagnose melasma. Apart from that, skin biopsy in rare cases when there is extensive pigmentation, melasma involving sites other than face, where there is diagnostic dilemma with other skin conditions, there we can do a skin biopsy to diagnose melasma. But if you are confused, like you, if you are having any melasma or not, just consult your dermatologist. He will be a better judge to know, to tell you that what disease you are suffering from.
Right. So going to a dermatologist is your first prior thing which you should do if you are having any symptoms or signs, because they will
See, you are yourself diagnosing a disease and then applying a wrong cream on it. You will be wasting your money. Better to consult a doctor, give a fee, and then take the medicine. You will get the right advice also, and you will get the right medicine also. So, if you have to spend some money on your creams and everything, just consult a doctor. Na? Get proper information.
Right. Anyways, you are spending your money, so it is an investment. You are spending your money. It's investment on your skin as well. So spend it by going to a dermatologist, because they better know that what suits you, what suits your skin. And as the doctor already told us that there are treatments of melasma. So if you are having any symptoms or signs of melasma, do go to a dermatologist. Doctor, we are talking about melasma, and here's a question from our viewer Rahul asking, Doctor, I have noticed brown patches on my face and I suspect it might be melasma. Can you please explain what melasma is and what causes it?
See, I told like melasma is a condition, skin condition in which there are symmetrical. Like most of the times, it's symmetrical. Symmetrical means like of same shape, same shape and same size on same site. Okay, bilaterally there are patches, brown colored patches on the face. Okay, they are initially they are asymptomatic. Basically, there is no symptom. So Rahul must not be having any itching if it is a melasma. Okay, still if he has a doubt about it, he can just message me on my Instagram or Facebook. Send me the pictures. I will tell him if it is melasma or not. Okay.
So definitely you can do that, and you can diagnose melasma. Doctor, when we are talking about melasma, is like a question come that is melasma itchy, or it is red, or it can feel pain as well? Melasma.
If you have treated yourself, like if you have applied any cream, any steroidal cream on yourself, any cream which has caused allergy due to that, that cream is not suiting you. Okay, sometimes I've seen patients are applying antifungal creams for melasma. So this is totally weird because this melasma is not any fungus. So if you are applying wrong cream on the face, okay, that is not suiting you. It can lead to itching or burning or pain on the face. Okay.
It's using proper cream is very important, and it is recommendable that you use proper creams and treat your melasma properly. Any advice you would like to give to all the viewers right there about melasma and hyperpigmentation as well?
Uh, As I told, see, melasma or any hyperpigmentation condition is a cosmetic thing. Okay, if you are okay with it, leave it. And if you want to get a proper treatment, then consult a qualified dermatologist. There are lots of doctors in the there are lots of people which are like beauty parlor workers, or they are just pharmacists, or they are just social media digital creators. They are themselves prescribing any left and right cream on their Instagram, or Facebook or social media platform. Do not rely on these products. Do not waste your money just seeing the advertisement on these social media. Consult a qualified dermatologist. Go pay a consultation fee and buy a good cream. Tell your doctor what is your budget, and then buy a good cream accordingly. Okay, doctors will tell you the correct advice. They will help you to get rid of your problem, but do not self experiment yourself. Okay, otherwise you will be in a big trouble just because of your what can I say, carelessness.
Self-medicating process of your own, treating your skin.
This self
Uh,
medication is causing so many troubles in the patient. So that is the advice I will tell. Okay.
Right. And doctor, what are the early precautions? If somebody is already in the family having melasma, what are the early precautions somebody should take of melasma?
This is a very good question you have asked. So I wanted to tell this also. See, it has been found in studies in like if you are going to be pregnant. Okay, most of the times, like in 60% cases, melasma occur post pregnancy. So from the pregnancy only, starting from the first trimester onward, you start applying sunscreen. Physical sunscreen is a good sunscreen to be used in pregnancy. Okay, so start applying sunscreen, and you will definitely not. There are less chances of getting melasma. Okay, so a preventive measure is sun protection and sunscreen application. They basically help to lighten melasma and to prevent melasma.
Okay, so applying sunscreen is very important if somebody wants, to prevent themselves from melasma. It is important that you take care of your skin, and as our doctor already told us about treatment, various treatment which are available, causes, right thing you can do for melasma. Doctor, before we end this very informative session, any takeaway message you would like to give to all the viewers?
Uh, Melasma is a cosmetic disease. Number two, there are many medicines available for melasma, ranging from topicals to oral medicines. There are not only topicals available, because some patient does not know that there are oral medicines also for melasma. They just keep on applying creams only. Okay, sunscreen and sun protection is a major plays a major role for controlling melasma. So one key point, if you want to get from this talk, is application of sunscreen is a must, and reapplication of sunscreen is double must. Okay, so you have to reapply sunscreen every 3 to 4 hours. Okay, and uh, consult a qualified dermatologist. Do not believe on quacks. Do not believe on social media. Not on social media digital creators which are not qualified dermatologists. Okay, so consult a qualified dermatologist. These are the things which I wanted to tell my public. Okay,
Okay, okay.
I
So
hope it helped.
yes, definitely. And I think you have told us about that applying sunscreen is very important. If somebody is having any kind of problem, they should go to a dermatologist. And very misleading informations which were there of melasma. I think I'm sure that all the myths and misleading information are corrected over here. So thank you so much, Dr. Meghna, for your valuable time. And
Thank you so
it
much.
has been a very informative session for our viewers.
Thank you so much.
And we really look forward for many more sessions in the coming time as well, because as you already told that they don't have to self medicate; they need to go to a dermatologist. So we really look forward for many more such sessions in the coming time for our viewers as well.
Thank you so much. Thank you so much, Ipta, for this opportunity. Thank you.
Thank you. Thank you so much, Doctor. And thank you so much to all the viewers for your excellent participation in today's session. And stay connected to our beautiful Spotless Skin page. Good day to all.